Okay, so this week we're studying in part experiential models of family counseling. These models are models that are focused on the phenomenological experience of the client, the lived experience of the client family, the members of the family, and the family as a system. For the most part, these models tend to minimize theory. The theoretical framework is just one component, but that is not the major focus of these models of counseling. These models of counseling respond to the here and now directly through engagement with the family by the counselor. So the change lies in the immediacy of the relationship between the engaged counselor and the family. This is definitely not, these models are not models of counseling where the counselor can sit back and just simply ask questions. The counselor is fully engaged with the family. It requires a high level of honesty and willingness to be very genuine and direct with family members and the family as a system. These models evolved from phenomenological techniques that explore that lived experience. These models all believe that the lived experience of each individual family member impact the overall health and well-being of the system. There's some humanistic goals of these models, and these goals include unblocking suppressed feelings, expanding that individual experience and the family experience, that lived experience, recognizing and expressing emotions in the process of learning to do this. And what I mean by that last part, that it's not just a focus on insight building. It's a focus on teaching the families skills and techniques strategies that they'll use outside of counseling to recognize and express emotions, to identify the emotions that they're feeling and express those emotions appropriately and in ways that facilitate communication. Another goal is the achievement of intimacy in relationships, closeness and warmth, and then again expanding that personal experience. I mentioned that one twice because I want to make sure we have that as a focus. The phenomenological experience, all of that is important to these models. The other thing about the phenomenological experience is that this is a term that you will, or phenomenological framework, this is a term that you'll use in this class, you'll use it in other classes, including your research class, what it really refers to is the lived experience of the individual. You know, how is that experience socially constructed or constructed by the individual with a sense of an awareness of self and context, and what can it tell you about the health and functioning of the individual? Theories that are related to this experiential model, So Goldenberg in that text, they cover this as the experiential model, right? And it's a whole family of theories. In some of your other texts, you're going to discuss or cover each theory separately, because they are separate, but there are some relationships. And it's important to think about these theories as related because the way you use them in practice, there's shared common factors. In your theories class, you learned about that approach, that integrative approach, that common factors approach. What are some core common factors that are the same across different theories that are then integrated into a cohesive method, theoretical framework? This is kind of similar. For these theories that we'll cover in the experiential model, or under the umbrella of the experiential model, they have some shared common factors. Some things are the same across all of these theories. They have some shared elements, but they also get applied somewhat differently. The other piece is that you'll read this in your readings and discuss it as we go throughout this module, that these theories are all shaped in part by the personality of the theorist and how that theorist applied them. Emotionally focused couple therapy, that one is probably the most clearly delineated, like how to apply this theoretical framework as counselors beyond the primary theorist. But a lot of the other ones evolved as a result of the counselors, that primary theorist, their personality and their therapeutic approach to counseling, right? So some of those are kind of unique to the theorists that developed them. And they can be somewhat difficult to replicate, but they're difficult to replicate in the sense that you can't do it just like Virginia Satir did, but the way you apply the human validation process model can be congruent and consistent with the primary components of the model. Okay. So these theories, some that we will be covering this week. Human validation process model, that's one that we'll focus on pretty heavily. This model believes it was developed by Virginia Satir, and the model holds at its core the belief that humans have an innate tendency towards growth and development, and that communication and self-esteem are the foundations for mental health. And the communication patterns and self-esteem of individual family members impact the overall health and well-being of the family system. Symbolic experiential family therapy was developed by Carl Whitaker. It has a focus on symbolism and the normalization of experience. Dysfunction, it focuses on depathologizing the experience. It just normalizes it, that we have a lot of times that the same processes that result in effective functioning for a family are the ones that, when applied somewhat ineffectively, can result in dysfunctional family processes. So it tries to normalize that experience, focuses heavily on process over content, and it's a multi-generational approach that requires initiative by the family. All of these require that the families be invested and willing to engage for them to work. And as a counselor, you build that relationship and encourage that investment. Emotionally focused couple therapy was developed by Susan Johnson and Les Greenberg. It's a brief, short-term approach. It's focused on identifying and then restructuring negative interactional patterns or negative interaction patterns. And it teaches skills for doing that to the clients that then they will use outside of counseling in their relationships and family relationships. Gestalt family therapy is Walter Kempler's adaptation of Pearl's work. It's very provocative, very personally focused. Your textbook calls it uncompromisingly honest and direct. That's what it is. It's in the present and in the real with the family, and it's definitely an approach that requires the counselor to be willing to be very direct and connected with the family in that way. The therapeutic frame of reference for all of these is the present and the futures, and these models are not heavily focused on the past. There's transgenerational consideration, how do they relate across these generations and to each other? And the therapist is the primary instrument of change. Therapists in all of these experiential models are actively and heavily engaged. The view of pathology. For the human validation process model, the focuses on communication, right? So families in which parental messages to one another and or to their children are incongruent with feelings, those messages are confusing, and they result in a lack of coping abilities, and they're maladaptive. The children cannot get clear messages, family members don't get clear messages from each other. Within this inconsistent communication, there are problems that then result in stress within the family, that stress gets transmitted to some client within the family, some member within the family that ends up typically being your identified patient or identified client. And there's ongoing damage because of these inconsistent messages to all family members' self-esteem. Symbolic experiential family therapy depathologizes the human experience. We talked about that before. Dysfunction is viewed in both its structural and process components. Symbolic experiential family therapy really tries to normalize that experience, that everybody experiences some difficult times, but by restructuring and focusing on improving processes, families can function effectively. An emotionally focused couple therapy believes that dysfunction results from rigid negative patterns that then block emotional engagement. So if I'm not open to you, and if we have these patterns in place that block us both from being engaged, or one of us from being engaged, then the family can't function in a healthy capacity. The intent of counseling for all of these is to focus on the present and the process. This helps the counselor and the family to actively implement changes in those processes that negatively impact family function. So when you're focusing on the present and that process that's happening, these theories all use experiential activities and components to get that process happening right in session. And the counselor gets in there and gets engaged with the family and works to shift the process so that then the family's functioning shifts as well. To facilitate family wellness and in terms of effective communication and self-esteem, and then effective communication overall, that's a major focus for these methods of counseling, to shift communication patterns and processes to more positive approaches that allow equitable, open communication within families so that family can function at a high level of wellness. And these counseling methods are all focused, or models are all focused on facilitating growth beyond the symptom. It's not just the resolution of a symptom or a concern, it's the focus on facilitating growth. And through these active, engaged approaches that these models use, they work to release and direct energy that gets tied up in symptomatic behaviors. Processes that don't work, or that are rigid, or that block communication, or that focus on pathologizing one member's approach or process in life, Those rigid processes that block those things, that block positive communication, tie up your positive energy. And then families can't function, but they're kind of bound up and they are not able to function effectively with a high level of wellness and support each other. And individual members don't have high self-esteem and can't have difficulty growing and changing. Some techniques that we'll talk about during our discussion this week will be some from the human validation process model, including family sculpting, family maps. These models, we could go through a lot of techniques for every one of these theories because these theories are heavily focused on that experiential component. How you apply those techniques in therapy is going to be somewhat different across theorists and across different clinicians, but that core component of being genuine, honest, and direct, that's there, right? Now, Virginia Satir was very, very warm. She's very warm with her clients. And so within her approach to being honest and direct was that warmth. That's very present and obvious when you watch her work with clients. Other counselors use that honesty and directness in a different way, equally as effective. But these are some of the techniques that you'll have read about, and you also read about other techniques as well because they're heavily experiential models, as you might expect by the name. So assessment, how does assessment occur in these models? It occurs simultaneously with therapy. In experiential models, you are working, assessing, shifting, and changing, so that the work continues and the assessment continues throughout your process. Symptoms are framed within a relational perspective, and entering into the family process, that becoming part of, joining with that family in a way that lets you be very highly engaged as a counselor, that's your first step in assessment. The treatment process for mostly focused couples therapy. This therapy form of or theoretical framework that we're discussing this week, this was probably your most well-articulated process. Some of the criticisms for the others were that they were too heavily reliant upon the individual theorists, their approach and process, and so it was very difficult to teach these as like cohesive theories to be taught for practice by other counselors. This one, they've really worked on laying it out, like how do we do it and how is it clearly articulated. This was covered in chapter 11 that you read, and I just repeated it again here to make sure that you had a chance to look at it. That laying it out clearly, the process for working with the family and identifying the issue and then establishing solutions and consolidating positions, that process will occur throughout treatment. One footnote from your text. So one of the things that you read, I'm not exactly sure the page. I'd have to look back, but in chapter 11, on page 266, right? It says that you talked about Virginia Satir departing from mainstream family therapy and going in to do some other work, right? So one event that hastened this departure was described here in this footnote. And the argument between Satir and Mnuchin, we discussed Mnuchin with structural family therapy last week. So Mnuchin criticized what he regarded as Satir's evangelical approach, insisting that more than the healing power of love was involved in repairing dysfunction within the family. Mnuchin is focused on structure and process that way, right? Satir is focused on relationship, communication, and process. So they're very similar, right? They work hand in hand. But there's a core fundamental difference between these two. So now we have had an airplane go by during our little video here, and also now a train. So you're getting all forms of transportation today. Sorry for the back noise. Okay, so they have this foundational difference, a focus on shifting structure or using the strength of the relationship between the counselor and the family members, and then the strength of the relationship across family members to improve communication patterns. We're going to discuss that more in depth in our weekly discussion for this module. So I wanted to make sure that you've read this footnote again. Please make sure you read this footnote, and then we're going to discuss this more when we get together as a group. That piece, that core component, what do you believe is most critical for success in family counseling? We may not resolve that completely, but I want you to consider it.